So, good morning everyone. I am going to report about the infarction. What is infarction? An infarct is an area of ischemic necrosis caused by occlusion of either the arterial supply or the venous drainage. It is injury or dead tissue resulting from inadequate blood supply, especially as a result of obstruction of the local circulation by a thrombus or embolus. So, there are red and white infarct. The red infarct is a venous occlusion, testicular torsion, loose spongy tissues with dual circulation, lungs, small intestine, tissues previously congested by a sluggish venous outflow. Re-establish flow to a site of arterial occlusion. Red infarct occur due to the venous occlusion or embolism in organ with dual blood supply where the secondary blood supply is unable to keep up with the heads of the tissue. It is red color because the small intestine has a dual blood supply. So here is the example picture of a red infarct. We will now go to white infarct. White infarct, arterial occlusion in solid organs with an end arterial circulation and tissue density that limit blood seepage. And it can be seen in the heart, spleen, and kidney. This is also called as anemic infarcts and pale infarcts caused by arterial occlusion. This is referred as white because of the lack of hemorrhaging and limited red blood cells accumulation. So this is an example of a white infarct. Infarction. Wedge-shaped, apex occluded vessel, base organ periphery, serosal surface can have fibrinous exudate. Fresh infarcts are poorly defined but delineates better over a few days. Ischemic coagulative necrosis, dominant histologic characteristic. It is a type of accidental cell death typically caused by ischemia or infarction. Septic infarction occur when infective cardiac valve vegetation embolizes or when microbes seed necrotic tissue. It is an area of necrosis resulting from vascular obstruction caused by emboli consisting of clumps of bacteria or infected material. Factors: anatomy of the vascular supply. Availability of an alternative blood supply is the most important determinant of whether vessel occlusion will cause tissue damage. The lungs have a dual pulmonary and bronchial artery blood supply that protects against the thromboembolism-induced infarction. Rate of occlusion: slow rate, less likely to cause infarction because they provide time for development, so it is a process of developing. Tissue vulnerability to hypoxia. Neurons, 3 to 4 minutes. Neurons undergo irreversible damage when deprived of their blood supply for only 3 to 4 minutes. Myocardial cells, 20 to 30 minutes. This is hardier than neurons and also quite sensitive and die after 20 to 30 minutes of ischemia. Fibroblast hours. Fibroblasts within myocardium remain viable even after many hours of ischemia. Hypoxemia. Abnormally low blood oxygen content increases both the likelihood and extent infarction. If blood oxygen levels are too low, your body may not work properly. So that's all for my report.